Welcome back. Now, this is a subject I think that some women maybe are afraid to talk about, or maybe even feel ashamed somehow, like they could have prevented it, or even feel alone when they have dealt with it. Judith Schuler is talking today about miscarriages. Now, Judy, even personally, I feel like I know many women that have gone through this, but maybe aren't talking about it or are afraid to say something. So this is kind of why I wanted this subject to be out here so we can kind of get some information out. A lot of pregnant women think about miscarriages for good reason. What really is it?
Well, miscarriage is a loss of a pregnancy, and it happens in 20% of all pregnancies. And 80% of miscarriages happen in the first trimester, the first 13 weeks. Let me clarify something for you, because I hear this a lot. People make this mistake. A miscarriage occurs up to 20 weeks of pregnancy. After 20 weeks, it's called a stillbirth.
Okay.
So if somebody's talking about a miscarriage, it should be in the early pregnancy. There are a lot of different kinds of miscarriages. They're recurrent, incomplete, missed, habitual, and your doctor will be able to tell you if you have a miscarriage, hopefully what kind you had. There's also something called a chemical pregnancy, which is under the miscarriage label,
right.
But it is a situation in which tissue forms and HCG, the hormone, the pregnancy hormone that makes a pregnancy test positive, is produced, but there is no embryo.
Okay.
So that's also under the miscarriage.
And I would probably assume, because there's all these new pregnancy tests that kind of indicate pregnancy even earlier and earlier and are indicating that hormone that you were talking about so much earlier, that probably that's why this percentage has gone up, because a lot of women are now aware that they're pregnant earlier.
Right. When I was pregnant with my son 36 years ago, we didn't have pregnancy tests. You had to go to the doctor, and the doctor would tell you to wait.
Yeah.
So today we're finding women are pregnant that before they probably would not have thought they were pregnant.
And I think that some women that maybe go through either a miscarriage or a chemical pregnancy or anything kind of run through that gamut of, what did I do? You know, what could I have done to have prevented this? But that's not always an answer or the case.
No, I mean, in most cases, we have no idea what causes a miscarriage. The main idea today is experts believe that it's abnormal development of the embryo. But we also know that there are some contributing causes, such as aspirin use and other medications, excessive use of caffeine, and we're not talking about tons and tons and tons of caffeine, but over 200 milligrams a day of caffeine can contribute. Even today, we believe the father-to-be's age may contribute to miscarriage. So there are a lot of maybe some reasons kind of that are contributing, but not necessarily the main reasons.
And some women may never know what was the cause of it.
That's right.
But what are some of the signs that someone is going through this?
If a woman has bleeding during pregnancy, loss of tissue, cramps, pain that starts in the small of the back and moves around to the lower abdomen, call your doctor immediately. There are tests that can be done to determine whether a miscarriage is occurring or has occurred. So it's important to discuss this with your doctor as soon as you have any of these signs.
And I have heard actually some different pieces of information on if somebody has had a miscarriage and they want to maybe try again to get pregnant, if that was their original purpose.
Right.
Is there a time frame you should wait if you want to retry?
There have been in the past, we've always advised women to wait maybe 2 or 3, 4 months. We want them to recover emotionally and physically. However, today we're saying many experts are saying to women, as soon as you have a period, if you're feeling good and you are emotionally ready, then go ahead and try. You don't have to wait. We want women to understand that no one is to blame.
Yeah.
And if you've been, dealing with infertility, there's a positive to a miscarriage.
Yes.
You have gotten pregnant. You can't say any longer you're infertile.
Right.
You have achieved a pregnancy. If you do have a miscarriage and you're Rh negative, they'll probably want you to have a RhoGAM shot.
Okay.
Realize that. But it's something you really need to get together and talk with your doctor about as a couple. because they may have specific recommendations for you. It's a good time for the couple to get together and talk about some of their concerns and questions and things like that. And your doctor is your very, very best source of information. So do use him or her for more than just the medical issues of miscarriage.
I'm very happy that you kind of touched on the emotional and when
Yes.
you and your partner are ready to kind of to go back into that. So I did say that this is a subject a lot of women maybe don't talk about freely or try to get information, and there is so much out there and probably is going through your own mind that I wanted this to be one of the subjects that we touched on.
And I think the most important thing is to realize that usually there's no reason.
Yes.
You can't say I did this or I didn't do that. That's part of the emotional healing.
Well, we always tackle a lot of subjects, Judy, and I think this was just another one that needed to come out. So thank you so much.
Well, thank you, Tina.
Now, for even more information about your pregnancy, you have to take a look at Judith's series of books. Learn more at yourpregnancybook.com.